Unfortunately, what we're seeing is what we oftentimes see whenever there's a commodity, something with value in a society, is that these inequities, these inequalities within the society often determine who gets it. And that's what we're seeing, is that a lot of the places, the folks who have easier access, the folks who are better able to manage whether it's online systems in order to get it, they tend to be more representative of those that are wealthier or otherwise tend to do better. And some of those areas, including those where you're seeing higher infection rates, higher hospitalization rates, higher death rates, are having more trouble in terms of getting access to the vaccine. There are some areas, that this is being paid a lot of attention to and trying to make adjustments, but unfortunately, it's something that that we are seeing.
And we're seeing some of this, it's really at the state level where we're seeing sort of these sort of line jumpers coming in. Talk about some recent examples of wealthy individuals or organizations that have used their money and influence to get faster access to the vaccines.
Well, I think what you see here too is you see there's sort of this squishiness around definitions, and some of it is that, so at a national level, when you want to provide a vaccine, you have to leave a certain degree of flexibility for states, for healthcare systems to sort of make this choice on who qualifies and who doesn't based on the operations. The way a hospital runs things in one state may be different than in another, and just the dynamics are different. Unfortunately, what that also means is that it opens itself up into being able to manipulate some of these definitions, where, you're probably hearing stories about in some areas where you have hospital workers who actually don't have any direct patient contact getting ahead of the line in some of these things, or you're seeing folks with connections sort of getting, trying to sort of weasel their way in with some spurious reason on why they should be in a priority group or something like that based on these loose definitions. In some cases, this is very overt, very intentional. In a lot of cases, not necessarily so. There is a gray area here. If you have an IT worker who occasionally has to go into the emergency department to work on the systems, is that an egregious violation? Probably not. There's a gray area there. But certainly that there are those that are unfortunately taking advantage of the situation.
And a lot of it also comes down to sort of that definition of how people are being prioritized. Do you sort of, try and vaccinate the people who are most likely to die from it or most exposed, or the people most likely to spread? So some people are saying, is there an argument to be made in favor of some of these large industries like Hollywood, for example, getting earlier access if some of these large swaths then will help sort of recreate jobs and get the economy going again? What's your take on that?
Yeah, this is where, different fields of science sort of intersect with the values of a society. And so I don't mean to sort of halfway dodge the question, but epidemiologically speaking, we know who's most likely to die, who's most likely to have complications from this disease. And so by getting the vaccine to those high risk groups first, you reduce the overall death rate, you reduce the hospitalization rate, which is really the most critical thing right now. But there is a broader connection. There's a lot of debate right now on schools and the risk to teachers versus perceived risk. And as you mentioned, with entertainment, with a lot of folks in lockdown or various degrees of stay-at-home orders, how important is entertainment in connection to the arts? That's a trickier conversation. And, certainly first and foremost, we need to protect lives and livelihoods. But I think that there is room to have conversations about broader societal benefit from some of these things, to a point. At the end of the day, what we have to do first is stop the dying, stop the hospitalizations, and then reduce the transmission so that we can slowly get back to normal.
And as we look at some of the issues that we're having with the system, then how are we seeing that play out in some of those most at-risk communities?
Yeah, so I think as I mentioned before, as we've seen where the vaccination sites being set up, how are they being set up? Who is setting them up? Are they being set up through health centers, through institutions that are already known and trusted within the communities, within these harder to reach communities, or are they having access to priority vaccinations? Unfortunately, what we're seeing, there's actually some really great maps that have been done, sort of showing hospitalization rates by zip code or census tract, and then vaccination rates. And it's almost like a negative of the other. It's like the polar opposite. You see areas where you tend to have lower hospitalization rates with higher vaccination rates. So right off the bat, we know that something's not right here. I mentioned before with testing, we also saw that a lot of testing sites tended to be in wider and wealthier communities back in the spring. And so it was harder to get access to testing. In addition to that, the communities that were further from testing sites also had measurably lower or higher transportation vulnerability, meaning that it was harder for them to get farther away to go and get testing. You layer onto that things like socioeconomic status, who is working hourly jobs, who are the essential workers who have to go to work anyway, and it just compounds what we see again and again in disasters. So that being said, I think finding strong community champions from within communities, in some cases, elites showing that they have, if they legitimately do deserve to get the vaccine right now based on their age, based on their clinical condition, that can go a long way towards cultivating trust. And normalizing that getting the vaccine is okay and getting the vaccine is something that should be done if it's done properly and in the proper